Thank you for the opportunity to ask a few questions. My name is Nienke.
My name is Mabel.
We have 5 questions for you. The first one is, there are a lot of post-COVID patients in the world. What is your view on post-COVID and the patients suffering from this?
Yes, there are a tremendous amount of long COVID or post-COVID patients, and they're suffering greatly. And their suffering is real. This is a real disorder that people who have it feel completely helpless and hopeless oftentimes. They've been told that they will never recover and that the disorder is completely biological and medical, and that their bodies are damaged and broken. And for the most part, I don't think that's true or correct. Everyone needs a careful evaluation to make sure that they don't have ongoing damage in their heart or lungs if they've had severe COVID. But the vast majority of people with long COVID or post-COVID syndrome had relatively mild acute COVID infections. And one of the things that's really interesting and important to know about long COVID or post-COVID syndrome is that some of the people who have it did not actually have COVID in the first place. Some of them had other viral infections. Some of them didn't have viral infections at all. And we know this from the research that's been done. And the other research that's been done shows that people who have been evaluated medically for long COVID or post-COVID syndrome, they have not found a significant amount of damage or disease or breakdown in the body to account for these symptoms. The symptoms are real, and they can be debilitating: headache, fatigue, brain fog, can't think straight, chest pain, migraine, stomach issues, anxiety, depression. And what we have found is that these disorders are treatable by using a mind-body approach. And we have seen many, many people recover, and we have a research study showing that the majority of people can actually recover completely or almost completely from post-COVID by changing how they think about it and changing their relationship to the symptoms and understanding that they can get better. And these methods have proven to be successful. And so we're very hopeful for the outcome of this disorder as we understand it better.
Wow. Thank you. You said already a little bit about it, but could you a little bit elaborate on what do you think about the results of the biomedical research on post-COVID?
Yes, there have been a lot of obviously intense interest in studying post-COVID syndrome because so many people are suffering from it. Some of the research has shown that you can find persistent viral remnants in the body. But that can be found in a lot of viral infections. They have shown that there's certain antibody markers, there are certain inflammatory markers, and even in some cases there have been shown to be some markers that have been shown in muscle tissue. And it's yet to be known 100% how important those are going to be. But we frequently see in these kinds of conditions that these markers are not actually the cause of the symptoms. They're not actually the cause of the severe symptoms, the fatigue, the brain fog, the headache, the migraine, the anxiety, the chest pain, the stomach issues. They often are the result of those things, or they're occurring because of some reactions in the body that have occurred to the virus that have occurred later, but are not actually the cause of the symptoms. And we know that that's usually going to be the case because we have treated people and they've recovered, even though they have those kinds of markers. And so for the moment, and new research is coming all the time, but for the moment, from my opinion of looking at the scientific literature on this, it is my opinion that these markers are not the actual cause, and that, again, as I said a minute ago, people can recover from this often debilitating problem, can actually recover by using the approach and the techniques that we've pioneered.
Why do you think some people develop post-COVID and others do not?
Yeah. We don't know exactly why some people develop post-COVID syndrome and others do not, but there are some clues in the research that's been done so far. One of the clues shows that sometimes people who develop post-COVID have had a perfectly fine prior experience. Their life prior to having COVID was perfectly fine. There were no problems. There was no trauma. We have seen that. That can certainly be the case. And we have seen, looking at the research, that there's a higher likelihood of developing long COVID or post-COVID syndrome if one has a history of anxiety or depression or loneliness prior to having COVID. People who have had higher incidence of childhood traumatic events, adverse childhood experiences, those people have a higher rate of developing post-COVID. And people who have histories of other, what we would call mind-body conditions, such as prior histories of anxiety, of migraine, of irritable bowel syndrome, of fibromyalgia, of chronic headaches, of chronic pelvic pain, of depression, of fatigue, of insomnia. And so people who have these kinds of things prior are more likely to develop a post-COVID syndrome. And the reason seems obvious because these things indicate that people with those prior conditions are more likely to have had a sensitized fight or flight reaction in the brain, a sensitized danger alarm mechanism in the brain that can be more easily triggered when they get an infection, and specifically more easily triggered when they get an infection for which there is a tremendous amount of fear of dying, because COVID certainly has caused death in millions of people around the world, not as much now as before. Fear of developing long COVID. So those are some of the reasons that we have come up with so far.
Many patients with post-COVID syndrome experience PEM. It is post-exertional malaise. What is your view on that?
Yes. We have seen post-exertional malaise in post-COVID syndrome, but it's also been seen way before COVID. It's not something that's brand new or has never been described before. It has been seen in chronic fatigue syndrome. It's been seen in what they used to call chronic Epstein-Barr virus situations, which we believe are all part of the same syndromes. So we've seen it, and it's common, and we believe it is due to a sensitized danger signal in the brain. So when you have fatigue and with walking, for example, with exercise, that fatigue can then, the walking can trigger the brain to create a higher level of symptoms. And so exertion is not causing this post-exertional malaise, but it's triggering the brain to create this post-exertional malaise. This is a conditioned response, and this is due to associative learning. And it's due to fear of getting the symptom, and it's due to fear of the exercise. And in the research study that was done at Harvard by one of our colleagues, Dr. Michael Danino, he showed in his study that 2/3 of the people who had post-exertional malaise were dramatically improved by using this mind-body technique. So we know that it can be reversible.
I've got another question. Could you elaborate a little bit about the brain or something about how it works?
Mm-hmm. Yeah, so this is a new understanding of neuroscience, and it is the concept of predictive processing. Predictive processing means that our brains literally create what we experience. And this view is unknown by most doctors, most psychologists, and most people. But it's the fact. We don't see with our eyes. Light comes in our eyes, but our brains create the images. We see when we dream in our sleep, so you don't necessarily need your eyes to see. When we hear, it's our brain creating the sound that we hear. The airwaves come into our ears, but our brain creates what we hear. And it's the same with our body. And so when you touch a hot stove, it's not your finger causing pain. It's actually the brain. And we know this because people can have injuries and have no pain at all. If you can have an injury and have no pain at all, what that's telling us, that simple observation, is that the brain, the subconscious part of the brain, this danger signal in the brain, makes a decision to turn on pain or not turn on pain, to turn on fatigue or not turn on fatigue. And when you get pain or when you have fatigue or anxiety, it's important, obviously, as a physician, to understand, is this brain being triggered by damage in the body to cause pain? Is this brain being triggered by not enough energy in the body that's causing fatigue? Is it being triggered by some kind of hormonal imbalance to cause anxiety? Or is the brain turning on pain or fatigue or anxiety due to neural circuits in the brain that have been learned? And this is the case with the vast majority of people with post-COVID syndrome, that the brain is turning on, creating the pain, the fatigue, the brain fog, the anxiety, and the other symptoms due to this alerted danger alarm mechanism in the brain, which, as I said before, is reversible.
Wow, thank you. What would be your advice for post-COVID patients?
My advice for post-COVID patients is to have hope, is to not give up, is to not believe that they can never recover, because we have shown that is not true. So that's the most important thing. That's the first thing. And to look critically at some of the science, and I know everyone's trying to create the best science possible, but from our point of view, to look critically at the science which says you can't recover, to look critically at the science that says your body is damaged beyond recovery. We do not believe that's true. We've shown that people can recover. And we have hundreds, not thousands of people who have recovered from long COVID by using this model. Once you do that, then you can explore, what does this model mean? What does it mean to begin to change the neural circuits in your brain? And there are a variety of techniques for doing that. But in general, the techniques revolve around changing your mindset about what the problem is, understanding that there's hope and that it's not a damaged body, a broken body. Number two, calming and soothing the brain in relation to exercise, in relation to walking, in relationship to thinking, in relationship to moving, in relationship to doing things, being social, and to start doing those things little by little, step by step, knowing that you're going to be okay, and reminding your brain that you are okay, that you're safe, you're not in danger, and you will get better. And as you do that little by little, you're training your brain out of these neural circuits that are causing these often severe and debilitating symptoms. And it doesn't matter how severe the symptoms have been. It doesn't matter how long they have been there. What matters is that they are neural circuits and that they can be changed. And sometimes in addition to that, one needs to look at the emotional situations which may have been going on in somebody's life at the time that they got sick, or even prior things in their life. There may be things that they realize that they have to change about their life in terms of their relationships, in terms of their work, in terms of their children, or in terms of their neighbors, or whatever it is. And those things can make a huge difference because we understand that stress and emotions can activate the danger signal in the brain, and the danger signal in the brain can activate real symptoms that can be severe, but again, can be reversible.
Thank you for this hopeful message.
Thank you so much for
you
the
so
work that you're doing.
Thank you.